Hi, let us read about classification of anemias. We will read type of anemia and laboratory findings together. First one is hypoproliferative anemia resulting from defective RBC production. First one is iron deficiency. In this, decreased reticulocytes, iron, ferritin, iron saturation, MCV, increased TABC. That will be in the laboratory findings. MCV means mean corpuscular volume. TABC is total ion binding capacity. I will explain later about this. Next one, vitamin B12 deficiency, megaloblastic. In this, laboratory findings will be decreased vitamin B12 level and increased MCV. Third one, folate deficiency. In this, decreased folate level and increased MCV will be present. And fourth one, decreased erythropoietin production. Example, from renal dysfunction. The laboratory finding will be decreased erythropoietin level, normal MCV and MCH, increased creatinine level. And fifth one, cancer or inflammation. In this, normal MCV, MCH, normal or decreased erythropoietin level and increased percentage of iron saturation, ferritin level and decreased iron, TABC. The second category, bleeding resulting from RBC loss. Bleeding from gastrointestinal tract, menorrhagia, excessive menstrual flow that is, and epistaxis, nosebleed and trauma. The laboratory findings will be increased reticulocyte level, normal hemoglobin and hematocrit if measured soon after bleeding starts but levels decrease thereafter. Normal MCV initially but later decreases. Decreased ferritin and iron levels later. Third one is hemolytic resulting from RBC destruction. Altered erythropoiesis, sickle cell anemia, thalassemia, other hemoglobinopathies. The laboratory finding will be decreased MCV, fragmented RBCs, increased reticulocyte level. And the second one is hypersplenism, hemolysis, increased MCV. Drug-induced anemia, the finding will be increased spherocyte level. Autoimmune anemia, in this increased spherocyte level. Mechanical heart valve related anemia, fragmental red cells. This MCV is mean corpuscular volume. MCV shows what type of anemia. If MCV is high, you have a deficiency of possible vitamin B12 or folic acid. If MCV is low, that will be iron deficiency anemia or thalassemia. In rare cases, MCV also indicate cancer of bone marrow like myeloblastic anemia, myeloblastic syndrome. And TABC is total iron binding capacity. This iron binding capacity also caused by also called transferrin. It tells us your body has enough iron or not. For that, if your IBC is high, that means body has enough protein to bind with iron, but there is less iron, so iron deficiency. In such cases, conditions, IBC is just a marker of protein. High amount indicate low iron in your body. In liver cirrhosis especially, this protein production will be less by the liver. In such cases, the iron binding capacity is low despite of iron deficiency. This IBC is a marker of iron deficiency to diagnose type of anemia. Also, MCV test also helps to identify type of anemia. Thank you.